Hello, dear friends. In our last clinical tip, I shared with you why it's so important to consider the health of our thyroid. This is because this endocrine gland produces hormones that influence almost every organ system and helps us to regulate many of our physiological processes. Due to the far-reaching impacts of the thyroid in our body, if one is unaware of thyroid issues, this can actually cause certain serious conditions and compromise their health in a variety of ways. This can lead to heart disease, osteoporosis, complications in pregnancy, and even infertility if the thyroid is not optimally functioning. So this is why in our last clinical tip, I provided you with some vital information about the thyroid. I talked about its functions, symptoms when the thyroid becomes imbalanced, how to check for thyroid functioning using different labs, some of their caveats. And then I also gave you two popular podcast links where you could listen and get some details on an integrative approach to how to care for your thyroid. Now, what I want to do is summarize all of the material I presented in the last video with some key considerations for integrative thyroid care. And I also want to share with you how essential oils can support thyroid function and highlight several studies where they have actually been used for several thyroid issues. The clinical takeaways from this video, I'm hoping can be used to aid you and your healthcare providers to enhance your thyroid health. Now, if you missed the last video and you want to see it or any previous clinical tips, look at any of the references or previous articles that I talk about, you can go ahead and check out the resource section in the video. There will always be linked there, as well as there'll be links in the transcript to various references. So let's go ahead and get started. Now, if we look at some key clinical considerations for optimizing thyroid health, it's important to remember that when you're dealing with thyroid disorders, that the issue might not be exclusively with the thyroid gland itself. So, for example, if there's an autoimmune thyroid condition, one needs to actually look at what's triggering an immune attack on the thyroid and, importantly, how to mitigate it. So a truly integrative naturopathic and functional medicine approach would be personalized and look at a person's biochemical individuality and their specific triggers and factors that are contributing to an imbalance. But there are some common aspects and concepts to consider when treating a thyroid condition in general. And these include the following. So here are the key clinical takeaways to keep in mind when you want to make sure that your thyroid is optimally functioning well. First is that the thyroid gland impacts virtually every process and function in the body. So your metabolism, your cellular energy, your brain, your heart, your gut, your liver, your nervous system, your reproductive system, and your immune system are all impacted by the thyroid. Another thing to keep in mind is you must support the gut and liver to ensure that the thyroid hormone converts to its active form, because a happy gut and liver also support proper absorptions of nutrients that thyroids need to function, as well as this conversion. If there are any infections in the gut, this can trigger thyroid disorders as well as autoimmune thyroid disease. So these should be considered when dealing with thyroid imbalances and mitigated. Stress and strain on the adrenal glands impact thyroid health. So if we look at cortisol and the neurohormones that the adrenal glands actually excrete when someone's stressed, these actually influence the conversion of the thyroid hormone into its active form. It can downregulate the thyroid. So when your body is in fight or flight, the last thing it wants to do is boost its metabolism for healing. It's in survival. One of the things too, it's important to remember is that thyroid is a hormone. So there's a delicate dance between all the different hormones. This includes estrogen, progesterone, DHEA, testosterone, and thyroid. So for example, if someone has super high levels of estrogen, or what we call estrogen dominance, in comparison to levels of progesterone or other hormones, this can actually downregulate active thyroid conversion. Progesterone, on the other hand, if it's in proper balance, can actually help raise cellular hormone thyroid receptor sensitivity. And then thyroid hormones itself can aid a healthy gut to detoxify excess and inflammatory estrogens, which would affect overall estrogen balance. So you need proper thyroid hormone to actually excrete excess estrogens, and estrogens being too high can actually down-regulate the thyroid. So we need to keep these things in mind that we can't just tweak one thing without affecting the other hormones. Chemicals in our environment can also act to dysregulate our thyroid as well as our hormonal system. And I did a whole series on how to green your life. There'll be a link in the video description for that so that you can help relieve some of your body of some of the toxic burdens it's up against every day. Nourishing relationships can actually assist with hormonal health. Nurturing social connections are often overlooked, but they can lower inflammation, and this influences hormonal balance. Hormones are sensitive to blood sugar dips and spikes. So it's important to be well nourished, and it's imperative when balancing hormones. So I know fasting is a trend right now, but for some people with hormonal imbalances and blood sugar issues, it's not their highest good to go a long time without eating because maybe their body is not suited for that and they're under a lot of stress. Lifestyle factors like movement, stress management, sleep, they can nurture your thyroid way more than you think, and they're pretty powerful. So when these are stabilized, there are less swings in all hormonal levels. So those are some of the key things to keep in mind. How impactful the thyroid is, how important it is to support the gut and liver, looking for infections, considering stress and strain with the adrenal gland, looking at the delicate dance between all the different hormones, considering chemicals in the environment, influential nurturing relationships, blood sugar, and lifestyle factors. So now that we know some of the key clinical considerations, let's look at how essential oils can aid us with helping us maintain a proper thyroid balance. And they do this by balancing the body overall and actually influencing some of these key clinical factors. So first of all, essential oils aid the immune system, inflammation pathways, cellular stress, and mitochondrial health. So balancing these aspects leads to better hormonal health and cognition. Brain fog is a big thing with thyroid disorders, so that's important. Essential oils can support enzymes that help the body detoxify and act as antioxidants. So this protects our cells from the toxic effects and assists with hormone sensitivity at the receptor sites. Essential oils are neuroprotective. They preserve cognitive health and they help to alleviate that brain fog that I talked about with hormonal imbalance. They aid in mitigating those stealth infections that can hide out in the gut and prevent autoimmune activity if they're mitigated. So remember, essential oils are naturally antimicrobial, antiviral, and antifungal. They can help balance neurotransmitters, which influences hormonal output. For example, thyroid hormone is linked to dopamine, estrogen is linked to serotonin, and progesterone is linked to GABA. They can enhance digestion and assimilation, which aids the thyroid-gut link, and they also support a healthy microbiome. Microbiome is where your body also detoxifies excess estrogen, and we know there's a link between estrogen and thyroid conversion. Essential oils can modulate stress, cortisol hormones, and resulting blood sugar imbalances as a result. They can enhance vagal tone and parasympathetic activity. They can calm the mind and body so that autonomic physiological functioning can be optimal. If you remember from the last video, some of the physiological processes that the thyroid impacts are also related to parasympathetic activity. They can improve our emotional health and help us heal from trauma and adversity. It's based on the concept of psychoaromatherapy and neuroplasticity. That was yet another clinical video that will be linked to in the video transcript. And they influence brain function and electrical activity. So how we think impacts our stress response and our perceptions, which impacts our hormones. Essential oils can also aid in directly addressing common hypothyroid, low functioning thyroid, and hyper high functioning thyroid symptoms. These include things as using essential oils to help relieve pain, inflammation, skin issues, often hormonal and inflammation issues are related to skin issues. They can help with digestive disturbances. The thyroid is actually important for gut health, and it actually helps movement in the gut. They can help with detoxification support and anxiety. And this is through some of the mechanisms I just discussed on how essential oils support overall body health. If we look at specific studies using essential oils for thyroid disorders, there is an oil called, I'm gonna I'm gonna do the initials, okay? Because it's a super hard oil to say, but it's SKEO. And this was taken along with antioxidants in a rat study, and it was shown to prevent lipid peroxidation and downregulate thyroid hormones in rats that had actually had too high thyroid hormone. Often in Hashimoto's disease, which is a common cause of hypothyroidism, autoimmune based, what ends up happening is sometimes the thyroid can actually go too high versus too low. So this is important to keep in mind. Ginger and lemon oils actually help to lessen salivary gland dysfunction in thyroid cancer patients. And an oil blend of peppermint clove, black pepper, white grapefruit, and bergamot oils reduced fatigue in a study with hypothyroid patients. If you remember some of my hormonal videos too, you'll probably remember that essential oils such as clary sage can also help with some of the thyroid stimulating hormones. So, in the past few tips, we've discussed the importance of thyroid and integrative care. We talked about why our thyroid health is so important for overall wellness. We talked about various symptoms and lab markers to measure thyroid dysfunction, integrative resources for thyroid care. We talked about clinical concepts to optimize the health of our thyroid in this video, as well as how essential oils can support our thyroid and our mind body in various ways. I hope you found this information useful for optimizing your thyroid function and using essential oils for your thyroid health. I would love for you to share your thoughts on my YouTube or on my blog. And if you like this content, it would be wonderful if you could support this channel by subscribing to the YouTube, as well as there will be links in the video description to go ahead and subscribe to my newsletter. This will allow more people to actually be attracted to the channel. It can actually help to maybe get some guests on that are clinical aromatherapists, as well as functional and naturopathic medicine doctors on the YouTube, as well as not just on the podcast. And as a subscriber yourself, you'll stay up to date on my latest clinical tips, blogs, news, and podcasts, and be the first to hear about the release of my upcoming brain health program.